Thank you for joining in tonight. My name is Tamer. I am the chair for the City of Elmhurst Commission on Youth. Our mission is to bring education on social and peer issues, as well as teen depression, anxiety, drug alcohol prevention, and we host a yearly job and volunteer fair. I'd like to recognize our commissioners who plan for these events throughout the year. Kim Brigman, Sarah Legisi with the Elmhurst Park District, Patricia McKernan, Marissa Mancini, Aaliyah Perez with Elmhurst Library, Bob Rasho, Derek Schlager with the YMCA, Mark Sowen, Sheila Wright, Ann Zimmer, Officer Tim Jorgensen, Alderman Danny Polumsky, Beverly Redmond from District 205, Officer Nick Waldenmeyer, and Rick Mojek. I'd like to thank them all for their continued dedication, commitment, and support to the kids at Elmhurst, especially throughout this pandemic. Thank you to the continued support of Mayor Morley, the entire City Council and staff, as we host this series of youth issues during COVID. We are grateful to Joe and Dan, his team, that we are live on Elmhurst TV YouTube channel. Please email any questions, Jackie Haddad-Tamer at elmhurst.org. I will be checking throughout the presentation. Also, I'd like to thank Cassandra Schreff, who has assisted on organizing these events to be virtual. The last event for the series tonight during this pandemic is alcohol and drug issues in youth during COVID. Alcohol and drug use is on the rise this past year. Jason Relle, who is an LCPC, is also the clinical director at Rosecrance. He is our presenter this evening. Jason has been with Rosecrance since 2011. He oversees substance abuse and behavioral health residential programming for adolescents. Jason is a licensed clinical professional counselor that has worked with children, adolescents, and families in various roles in Rosecrance. He earned his bachelor's degree in psychology from Miami University and his master's degree in marriage and family therapy from Adler School of Professional Psychology. We are very excited that Jason is here with us this evening. Thank you, Jason.
Thank you so much. So tonight we're going to be talking about adolescent substance use and current trends related to drug and alcohol use in the teens, especially over the last year, and learn a little bit about what's happening with them, especially amidst the pandemic and COVID-19. So just wanted to start with a brief overview of what we're going to be talking about today and establish a little bit of a foundation of our conversation this evening. So we're going to be talking about a Monitoring the Future survey that typically goes out to 8th, 10th, 12th graders. We're going to be talking about warning signs and risk factors for use. We'll be talking about general substance trends that we're seeing in the field, and even personally and anecdotally I've seen over the last couple months to last year. And then potential COVID-19 implications. We may not have all of the answers yet because research is currently being done and compiled, but we have started to see some things and can puzzle piece together what may be coming for our teens in substance use. And then I want to talk about intervention, initial intervention. What can we do? How can anyone out there help? And I think that's so important in just starting the conversation about substance use. So I wanted to talk a little bit about my role and what brings me to this point in this evening in this conversation that we're having on substance use with adolescents. So Rosecrance Griffin Williamson is where I am the clinical director, so I oversee all of our behavioral health programming for a residential short-term facility that's 42 days that sees both mental health and substance use clients. So with those behavioral health services, what I can anecdotally say over the last year especially is our admissions to residential level of care. Just at that, we can start there as a trend. That access to our care has decreased. So our current year to date in our fiscal year, so that would be from July of last year, 2020, through current, we've had about just under 600 admissions. And for an 80-bed facility, we would have seen many more clients over that time. So that's the first trend I wanted to note, that access to care, and we'll talk about that a little bit later. And then our population, that hasn't really shifted. So we see anywhere from 12 years old to 19 years old, they stay with us for that level of care for that 42 days. And we haven't seen a shift in that really. So cannabis use disorder is still the #1 thing that we're treating. It is about just over 50% of the population for us. Second to that is actually depressive disorders. So those go hand in hand a little bit. We are seeing alcohol, benzo use, and really a lot of other secondary diagnoses as well. So much of that co-occurring mental health and substance use disorder in our treatment services. So setting the stage, it would be really important to go over the Monitoring the Future 2020 survey. This is where professionals and families and teens can get a lot of data from that teenager's response in completing the survey. The difficulty this year with that data is that it was only about 25% of the sample. And why that is, so typically it is gathered in the earlier months of a year, so last 2020, right when COVID-19 started, is when the survey started to roll out in education settings, in schools, in high schools, and in 8th grade classrooms, and then that all stopped. So with that, it's only about 25%, as I said, of the data, but we did see some interesting trends that I think it's really important to go over and discuss at this point, because this is where we get a lot of the feedback directly from those individuals that are impacted. I always think it's difficult to talk about teenagers and adolescents because in the work that I do, we get a lot of collaborative information, so that's from other professionals or family members or parents. It's really important to hear from those teens too. They're the experts on their lives. Now, does that mean they always have every answer? No, that's what we're there to guide them for, but they know what's going on. They know the trends. I learned so much from those individuals. When I'm sitting in my office and talking to someone, I think that's when I get the best information. I also learn what I don't know. And the questions I ask lead me to really figure out what's going on. So with this survey, it gives a really good idea of where the field is going, especially related to substance use. So first and foremost, marijuana use. I think just since really 2015, it has been recognized as the most commonly used substance amidst adolescents. And that has increased and continued to increase over time, really dating back 10 plus years at this point. That daily use with those 8th graders to 12th graders goes anywhere from 1% to 7%. So that's a pretty high number of daily use. Now, what's really interesting about this study, again, prior to the pandemic, so that these numbers might be a little off when we're talking about people in lockdown or quarantine situations, there wasn't a statistical change. So no increase, which is a really good thing because it has been increasing over the years in that cannabis and marijuana use. The same could be said, I know a lot of people talk about vaping. I think some of my first experiences with vaping in the residential setting were hearing it directly from clients. I heard so many stories where individuals would say, yeah, I asked my teacher to plug in my USB at school and they plugged it into the wall for me, and little did they know they were charging a vape device, because that's exactly what it looks like. It looks like a USB, and you wouldn't even know. So I needed, again, the teenagers to tell me, over the last several years, show me the devices, and really educate me on how they were using these things. Now, vaping shows dramatic increase over the last several years. However, again, it kind of leveled out in terms of nicotine vaping. With that being said, I think that's really great. It's still, again, with marijuana and vaping, even though they're leveling out, it's still much higher numbers than we would definitely want for our adolescents and teenagers. And we'll talk a little bit about the impact of even vaping with that nicotine or THC and what that looks like, and how that could definitely have some longer term effects. But in terms of this study, those numbers steadied, which is actually really great, again, prior to COVID-19, and even some things coming out anecdotally it wasn't maybe not as accessible, the vaping, over this time too. If you're in your home, things you can't get the devices or you can't go purchase them as readily. So I think that's really important. Most importantly, as it relates to vaping, is that in this study, teenagers and adolescents actually said that they understood the potential long-term and harsh impacts health-wise that vaping could have, where in previous Monitoring the Future surveys that wasn't the case. So the fact that that increased, that means awareness levels, education, and what we're talking to our teens about is really important. And that's doing something to at least tell them, okay, this isn't all right for your body. We've had so many news stories over the last 2 years probably about ER visits and the impact on lungs of vaping. So it's really good to know that those conversations with teenagers, even if they're still using that device, they know the potential impacts it may have. Alcohol use, in terms of this study, again, another thing that leveled off. And when we say level off, that means it's pretty much similar to the years prior. That is good to know. It hasn't increased in any way prior to COVID-19. However, it had been on a steady decrease in other years. So that decrease did not continue. So that means that same level of use of alcohol was really prevalent. And we've seen that with teenagers. I do assessments for teenagers too that come in to our facility, and I've been working on our early assessment unit that really looks at someone in the first 5 days. And just, again, what they're telling me, the ease of access in the home right now to alcohol, that they can really, it's readily available in the home. It's not something they even have to leave to go out and get. And we'll talk about it a little bit later, but if you're bored, if you're experimenting, if it is right there for you and you're already isolating in your room, it's really easy to take your first drink. And that's what we're hearing from so many people. And again, there's not necessarily statistics that show that. However, just hearing from the teens and the handful that I get to work with of those individuals that are admitted, that's what they're saying, especially after this survey over the last year. Amphetamines, so that's also something to note. In 8th graders, actually, we saw an increase in numbers, and it was a pretty dramatic increase to use around 5-6%. Doesn't sound like a lot, but we're talking about 8th graders too, and that the fact that that number almost doubled from last year shows us that that is definitely something we want to continue to be aware of, and at younger and younger ages. I have had individuals that I've met with, seen, that have been 12, 13 years old that are using all of these substances at this point. And so that's really where we're at. We want to make sure that we're not in our minds thinking that just because someone is in 8th grade or potentially younger, that this isn't a realistic option for them to turn to some of these things. Cigarette use also, per this study, leveled off. Another really good thing. What you're hearing me say a lot of, though, is that level off. So not a decrease in the numbers that we're seeing, just a steady, from year to year, this is how many teens are using. So really just important to set that stage. I do think it's also important to go with that amphetamine use with inhalants. Also in 8th graders, that percentage went up too. So again, be aware and beware when it comes to some of our younger individuals that we also want to have some of those conversations. I think it's important, especially as we're talking about substance use, as it relates to the potential impact of COVID-19 over this last year, we need to understand the warning signs and risk factors. And a lot of people know these and have heard them. Why it's important to go over it again tonight is due to the direct relationship it has with COVID-19 and what we may be seeing. So certain warning signs. That someone has a substance use, right? So any habit change, and I know if you've listened to other presentations on mental health diagnoses or disorders or symptoms, That's the same in all of them. Losing interest in activities, shifts in mood. I could be easily talking about depression. I could be talking about anxiety. Any physical changes. This is an important one as it relates to substance use disorders, because you may see a reddening of eyes. You may see someone losing weight. Again, as I work with individuals who struggle with using substances, I often ask them questions about their sleep and eating habits. That is something that we talk about and assess each time, or even if I'm in conversation, we're talking about. So many talk about the struggles with falling and staying asleep at night, and so many talk about appetite being suppressed while in that habit of using substances. And I think those are two really important things to note, because if you're starting to see those changes along with any mental health diagnosis, we want to recognize that. We want to be ultimately aware that our child, our adolescent is changing in some way, and maybe raise a red flag to where, okay, our ears are perked, our eyes are open, and we're noticing what's going on in front of us, because it's really hard sometimes to do. Any social changes. I think this is a really big one that we don't think about a lot, because social connection and changes in friendships, that happens a lot during adolescence as we're going through just normal transition, and we're learning social skills, we're learning more about ourselves, and we shift our friend group entirely. Why that's important to note is because some of those social changes in who someone's hanging around with and keeping company with can absolutely be a warning sign of using substances. It may be that new group that they are using with. Now, could all of these things be something else, or could that just be a normal teenager? 100%. So I think it's just important that we know these things so we can understand what questions to ask and what to notice, and then when to intervene. And then behavioral changes. So that goes a little bit with shifts in mood, but are there more impulsive behaviors? So, someone who traditionally wouldn't take what they want, or kind of show us some level of defiance, right? Or rule breaking, or we start to see some sneaky behaviors or manipulation. Someone's hiding a little more. Somebody is sneaking in and out of their bedroom. And we know what that looks like, right? So I think that's super important to be aware of. Again, that could also be normal teenage and adolescent changes. So it's just as it relates to substance use, this is the signs that we want to see. And then with risk factors, if we've struggled with any substance use, if we're using anything in the home, if we're drinking alcohol, that makes our teenagers all susceptible to substance use as well. If there's a family history beyond that, grandparents, aunts, uncles, that is a number one risk factor. Adverse childhood experiences. So with ACEs, it's any exposure to a potentially traumatic event or something that has really had a profound impact on that individual's life. So just being aware that that's something that increases your risk to potentially use a substance. Behavioral health concerns, so again, having those diagnoses, that major depression, those anxieties, and reasons then that we start to use a substance to cope potentially with those things going on. Availability. That's a huge risk factor. Is it readily available? Where is it? And how do I have access to it right now? So that's actually something with availability that I did read in an article related specifically to COVID-19, where they asked responders to talk about what that looked like. And responders said that during the pandemic, they weren't sure about availability. So at times they found themselves even buying more substances. And these are adult responders, more than they may have needed, because they weren't sure if they were going to be able to continue to get those substances. So that also then was involved in a cycle potentially of increased risk of overdose, increased risk of being worried about overdose, and increasing your overall use in general because you have more readily available to you that you haven't used in the past. Any environmental factors. So again, are your friends using substances and you're the only one and you're around them all of the time as a teenager, and that's kind of the habits that just align with what they do. They go and smoke, or they go and have drinks, and that means that we might be susceptible to doing that as well. And then another really important risk factor that I think I really want to make special note is age of use. So the starting or initiating use. What we're learning more and more from studies and statistics, and there was a study in the Journal of Pediatrics, so JAMA Pediatric Journal, that talked about 12 months after teenage first use and the likelihood that somebody would then have what would be considered an addiction or a use disorder. For both cannabis and opioids, it was about 11% more likely that teenager would become addicted after a year if they first used in that adolescent and teenage time versus a young adult population. That's really important to know, and I know we think about it a lot. We think about, well, the brain is developing. We know the brain develops into the 20s at this point. But this data shows that likelihood of someone using, even recreationally, with cannabis or opioids, they are 11% more likely to then develop some addiction to those substances. That's a huge number. It may not sound like it, but the likelihood that the younger you use for a first time, the more likely that you're going to have a use disorder over time. That's something that means we need prevention. We need to catch some of these things really early on for treatment. And again, I said it, but that idea of recreational use, because we hear it so much right now, I think, in society, but it has the potential to have long-term impact. So what we knew about the initial COVID-19 impact, and this is way back, it feels like so long ago, in June of last year, and this was really just a point-in-time survey, but what the CDC, Centers for Disease Control and Prevention, put out is just initial statistics when those were struggling for the first few months of the pandemic. So what's important is that 13% started or increased substance use in that time. And why I set the stage with that particular number is because that's, at this time, so long ago it feels like 9 months ago, where we were collecting this data on the pandemic and what it was doing for individuals. And I think that we want to be aware of that, so because this is one of the only data points that we really have that was collected and is out there for us to see how people were just coping with a whole new set of stressors. So other use trends that we're seeing and that I'm seeing and can speak a little bit about, so identified reasons for use. A lot of, and this even specifically as related to the point of vaping. So that Monitoring the Future survey also does a really great job of asking individuals, with vaping, what was it about it? What, in using substances for that time that you reported, what were the reasons for use? And the first one, that the teenagers themselves were reporting, is experimentation. And that could mean so much, right? However, just trying to see what it would do, see what the effects were like. Maybe they see other individuals doing it. There is this idea of that if others are doing it and it's kind of the acceptable, normal thing to do, that why not try it? It's not hurting them. At least it's not hurting them in this moment that I can see. So why not? Others reported taste, and I think that's a huge piece. Even in the work that I do, that's a huge piece because so many individuals come in and talk about vaping, and they talk about, how they're, using e-cigarettes or something in all of the flavors or different things that are readily available to each of those individuals. So I think it's important to note that taste was that high up for vaping, that there's a reason for that. And I know there's a lot of jurisdiction and other things that have talked about what flavors are available in that, but it's important to know that was something that teenagers said was a reason that they were, vaping. Other reasons, just having a good time. So I think about that one, and again, it goes into that idea of the teenage brain. It needs social connection. It also needs that reward center and pleasure activated. It needs, a lot of instant gratification, especially in today's society. I think that I'm learning that more and more as I work with individuals, that need for constant gratification in the moment. I need it right now. It's a society where I can pull out my cell phone right now and look up anything. I know when I'm even watching a movie, right, and I want to know the backstory, I find myself on Wikipedia and finding everything I need to know right now. I can't wait to go to the library to check out a book, and that even more so in that teenage brain and how it's developing, they need a lot of that access. So that idea of both experimentation and good times together for identified reasons for use go a long way to say why someone would be susceptible, and then susceptible for continued use. So other reasons just related to relaxation, tension and stress reduction, distress skills. I think all of those reasons for use are really important to recognize as well in somebody, because there's an opportunity to intervene there with all of these things. If we think about tension reduction or stress reduction, distress tolerance being something that is a reason for use or an identified reason for use, again, that's readily available, but what other skills can potentially replace that? What are some things that we can do even together as families or communities or classrooms, even virtually, that promotes right here, right now skills that we can do? I know in this room I'm in right now, I can ground myself. I know I can name so many different things around me. I know I can remain present. I know I can start to, if I'm feeling anxious during this presentation, I can hold this glass of water. The coldness will help me reduce. And that's right here, right now, something I can do. I don't have to necessarily wait for therapy, which is hugely important, but what skill can I do in the moment that helps me reduce that? So if we know those reasons for use, especially in our teens, then it means that we have an opportunity to intervene. Things that I want to definitely note are benzo use and fentanyl. If I did a presentation, I think, on substance use in adolescent and teenage trends and didn't at least mention these, it would be difficult from the standpoint that I want people to know what that is, what exists, in the education around it. So even anecdotally, without statistics in front of me, I have heard more and more individuals just coming to me over the last couple of weeks, and each of them reporting use of benzos, Xanax use. And my follow-up questions are always, well, is this prescription? Is this, where are you getting this? How are you getting this? And a sad thing for me with this is that a lot of individuals don't know if it came from a bottle. Not that it would make any difference, but they're not knowing where this is coming from. And you can go find right now that how many things are pressed, created, made to look exactly like that pill and isn't at all. So it's huge to note that trend, especially with adolescents and teens, because if they see that pill that they know someone's prescribed, oh, that so-and-so uses this, or I've used this for anxiety, that inherently makes our mind think it's safe. But that's not doctor prescribed. That's not something that has been a dosage for our body. We have no idea how our body is going to interact with that symptom. So even though it may calm, we don't know what we're putting in our body. And then with fentanyl and synthetic opioids, that is 50 to 100 times more potent than morphine, we look at that, and that is being placed in those pills. That's being placed in other substances that our teenagers are using, and that's really lethal. And I think I need to mention that one because we have to be aware that that's happening, and others have to be aware that really we're talking about lives when it comes to all of these things, but especially something that is that potent, that lethal, and someone does not know what they're putting in their body because it's laced in other things. It's pressed into these, potential Xanax pills that someone is taking. Overdose and substance use trends. We have seen preliminary numbers. It's really hard to track overdose deaths in terms of how they're reported, things like that. So I won't specifically speak to those numbers, but we do know those numbers, reported numbers, are increasing and have continued to increase over that pandemic year, and not specifically related to adolescents and teenagers, but just in general in opioid overdose deaths. And then going back to that idea a little bit of fentanyl, opioids are the #1 substance related to overdose. So it is really important to note that. So we've talked a little bit about initiation of use and addiction rate, how that age is associated as a risk factor with potential addiction. We've talked about the idea of vaping and cigarettes leveling off in some degree. I did want to point out, though, with that initiation of use, addiction rate, vaping, nicotine or cigarette use, that you are more likely to use cigarettes if you vape, based on a lot of statistics. So that is, again, although it's an alternative to for many people, and that's what they report to us, and that's what we see from conversation and some research, it has led to increased cigarette use or more likelihood that you will use cigarettes over time. So really important to know. And then just going into this whole idea of what other trends, and maybe it's not even on this particular slide, but we are seeing younger and younger even trends related to stimulant use and potential non-fatal overdose in individuals as young as 15 and younger, where that number is increasing of reported non-fatal overdose from stimulant use. So I think we can talk all night about each of these different categories and substances and what use looks like right now. But these are the big things that I'm even hearing and seeing directly from clients and some of the research, and we still have some ways to go to get some of that teenage and adolescent research back from this last year of the pandemic. Parental use status. So this one is important in that we're finding more and more that cannabis or marijuana use in the home, especially related to parents, relates to potential use or addiction increasing in adolescents or offspring in the home. So if parents use marijuana in the home, the likelihood dramatically increases that adolescent can develop addiction or use over time. And interestingly enough, this particular study that I was reading related to mothers and mothers' use in the home as well was really important to a potential predictor of use for that individual in the home. So I want to make everyone aware of that, because as we're talking about that, sometimes I have a lot of teenagers come in and even with all of these things, I give a survey or something and it has a question on there talking about have you used any illegal street drugs or something like that? And then those individuals say, most of the time, if I ask that question, they say, well, does weed or marijuana count? I said, well, is it legal for you? And they're like, no. And I said, yeah, of course it counts. So it's something that even that idea of use or recreation use or parents with it, we want to be aware of that. And then I think, what can we think about related to COVID-19 and what potential implications, because research is still going to be being published, it's going to be coming out, so I'm going to be constantly looking for these trends. I know there recently even some mental health information has come out over the last year. But if we think about the relationship with those warning signs and risk factors, so if we know that somebody potentially being isolated or in a home with somebody in a situation where a parent uses or there are behavioral concerns in a home, then that person at times hasn't been able to really get away from some of it, or they've been constricted even socially to engage with other individuals. So that idea that boredom or not having other leisure activities as a potential risk factor, I think about COVID-19, and for a lot of it, our adolescents didn't have those social outlets or leisure outlets, so there was a lot of periods of boredom. There wasn't a ton that they were necessarily doing. So those individuals we talked about that may have used the substance for the first time, or that experimentation idea. It's something really important to think about in how those warning signs and risk factors really come into play with some of that. At the same time, with every potential for the positive and negative, it all exists. So if we need social connectivity and being bored in something, maybe increased use, there is a potential too that we were no longer around the individuals that we were using with or using substances with in that social setting. So it could absolutely also mean that there is that we weren't in the environment to use. So that's why I think with each of these items, it's really important to note and notice that we're not sure yet. And I know in a presentation and you want to hear all these facts and answers, these are just the considerations and that we all have to be aware of. So this idea of being in lockdown, even feeling in lockdown, feeling trapped, that idea of escapism and those teenagers having to escape in something, calm themselves with something. We do know from different studies that solitary use increased. So that's scary to me and others, I think, in the field for a couple reasons. Because if someone solitary use, so using by yourself in your bedroom where you're isolating or something, is increasing, that absolutely increases the likelihood of potential overdose, not really knowing what you're doing. Someone may not be checking on you. So I think that parent monitoring piece is hugely important when it comes to that. Again, the relationship with lockdown, as I was saying, with that social connection reason, we also know some substances are social contagions, meaning that if someone is using in my peer group, I may use. So is there a potential that for some individuals, risk may have reduced for that substance? We talked a little bit about boredom, changes in peer group. Role of the family. So family members in the home, there may be situations that are really stressful. There's chaotic family environments. There's exposure to violence. There's exposure to potentially traumatic experiences in the home. And if we're looking for that idea of escaping or doing something to cope, and we have no other way to cope but kind of shut our doors, shut out of it, and use substances, there's definitely an increased likelihood there or potential implication from being in the home in an environment that I can't get away from, and I'm yelled at all the time, or my parents are fighting all of the time, or I don't get along with my siblings, or we don't have a lot of space, so I'm sharing a room with someone and never able to get away from them. The role of the gatekeepers. So I think even as it relates to, I was talking about admissions just generally and access to care, there's this idea that, especially for teenagers and adolescents, so many referral sources are the individuals they're seeing as therapists or school counselors or their teachers or individuals who are able to identify that this is a problem outside of the home. Parents do an awesome job of identifying, but we have that other layer of individuals that teenager was seeing all the time. They could also be someone who notices changes in behavior, slight changes, because they saw them almost every day. When we went to virtual learning opportunities and not being in person as much, that opportunity for that gatekeeper to also be a source of identifying what was going on with that individual and telling someone, letting a parent know, and then getting them a bridge to professional help, that went away for a while. And I've talked to, again, so many teenagers who have said, I was able to use, virtually. They didn't know what I was doing at home, or I could step away for a while or prior to, and then I could just turn on my computer and be there. And again, there maybe not be those studies to back that up, but from even hearing that from a couple individuals means it's a couple more than that we want to have eyes on. Overall access to care in this idea of services. Initially, many services were disrupted, shut down, especially in the substance community. I mean, going to meetings, having a sponsor. The idea of having a sponsor face-to-face is hugely important. Being a peer and getting that peer support, going to a peer-chaired or led meeting. Those are all important to the fellowship and community of substance recovery. And initially, those were disrupted. Some didn't have access to that care. They didn't know where to look. Now a lot has shifted to virtual. That human connection piece is gone. But again, this is another idea where that's really difficult when you lose your services, you get disrupted, you're not meeting with your therapist. Something that's emerged in a positive way is that geographic barriers in a lot of places went away. There's an opportunity now for individuals to access care when maybe there wasn't the care to be had in their area before. Stressors, changes in routine responsibilities. So I know a lot of us haven't maybe thought about some of the things that our adolescents or teenagers have been trying to manage over the pandemic because, I know for me, I think back and they were just life markers that I did and weren't as important for me, but maybe they were in the moment, like attending my graduation or prom or dances or that football game on Friday nights that I went to and was around the entire class and school and those social connections that my brain and I desperately needed. A lot of those went away. Family vacations that were really important went away. Seeing my parent lose somebody close to them because of COVID-19, seeing stress and loss of job. These are all things that teenagers I talk to are talking about. And we have to be aware of that because those are all those risk factors for increased substance use. And those are things that absolutely acted as stressors over the last year. It's also something, even with school, because school is a big risk factor in how we're doing and functioning in that environment. That went away, and a lot of the individuals who maybe struggle with staying focused, being able to pay attention, needing some of that social outlet because isolation is something they were doing due to depression, that became almost more available for them to do by just turning on the computer and being able to disconnect in some capacity. And then again, those are just potential warning signs and then ultimately risk factors of increased use. And then that idea, something about residential treatment, even intensive outpatient treatments, partial hospitalizations, going to a therapist, going to your meetings certain times, that's all routine. And adolescents, as much as they maybe don't tell me all the time, they thrive on that structure and accountability. And those were all things that kept someone in a routine, even getting up for school, having to shower and put on clothes and go through this routine, and then I have an appointment or I have to go to my practice or something after school. That potentially was all disrupted. So again, it afforded more opportunity, or an implication could be an opportunity to engage in unhealthy patterns of coping or unhealthy routines. And then so with all of that information, what ultimately can we start to do? Or if we know these things and how they impact, oh man, boredom is really something, or that social connectivity, or yeah, there has been a lot of stress. I've been stressed, or I've been increasing my use. Even, a lot of use increase for individuals, not to the point when we talk about addiction or substance use disorders, but even, over this last year, I've had a couple more drinks maybe in the home, and that's what people are thinking or families are saying, and that doesn't mean it's problematic. It's just that's all part of those environmental risk factors that teenagers are now seeing and gaining access to. So this is the first step, really, being able to watch this, educate yourself on potential trends, and continue to look for those things. Recognize the warning signs that we talked about, even if there's slight changes in behaviors. And then remain open with those lines of communication with teenagers. I know it's really hard. I know it's difficult. It's the answers. Even when I ask right, professionally and they're like, I'm fine. Everything's good. It's all good. I'm fine. That check-in is hugely important, and just taking that time to be able to check in, care about them, let someone know, well, these are the things I've noticed. I'm here if you need me. I care about you. I love you. I'm here. Sometimes those lines of communication mean we've seen something, we've definitely recognized those shifts, and we have to be a little more direct in our approach. Ask those questions, monitor. If we know isolation and boredom are something that are increased, check in. Maybe someone isn't in their room for 8 hours at a time or something. Not forcing them all the time to come out, but yeah, encouraging, planning things. Another important thing is when we're monitoring those situations is being aware of just what's going on, who our adolescent is hanging out with, the peer group, where they're potentially going. That's all really important. Ask questions of them, even if you don't always get the answers that you want to get. We have to be able to ask questions. And then when we don't feel comfortable, know your resources, know what's available to you, know what's out there, gain that level of professional help, because you don't have to do it alone. And I never want families, especially when we're talking about substance, because there is resistance at times. People are stuck in, pre-contemplative stage of change where they're not willing to admit that they have a concern or there's an issue with substances, and that's okay. You don't have to get into that resistance fight all of the time. Let somebody else either assess that or have another set of eyes on it and be there to support you as a family member. And then ultimately, if any of these signs are like, oh yeah, get help. Help doesn't mean that someone's going to be in residential care. Help doesn't mean that they're going to be now attending groups daily or having to go to a hospital level of care. Help just means you're in the door and having someone else ask you questions and look at a potential concern and then give you recommendations and referrals. And let them have some of those difficult conversations that are really hard with adolescents. With knowing the resources, I think it's hugely important that I just, again, talk about what resources potentially could be available. With Rosecrance, where I work, Griffin Williamson in Rockford is our adolescent residential campus. In Rockford, we also have an adolescent recovery home where individuals can go and step down for transitional living if they're not ready to return to the community. I think that's really important. I wanted to tool or equip people to feel like they could be successful in that they had some resources at their disposal to at least be able to make an initial phone call. Something that's also available to individuals, like I said, that has been available throughout this pandemic. A lot of places shifted to virtual care, and virtual care means that geographic barriers may not exist for you. So there are tons of virtual adolescent options with so many different organizations. With Rosecrance, we have those that are available to you, and they're intensive outpatient groups that meet a couple times a week for a couple hours. And that peer support is hugely important then, because they can connect with other individuals that are similarly struggling with some substance use. There's low-intensity outpatient groups if they're not quite ready to go through all of those levels of care. And then ultimately, we have locations in several different places. I think finding out those resources is important largely because there are so many places. Rosecrance, we offer free phone assessments. And there are other places that also, you can come get that. So even if you're like, I don't know about all this, this is so overwhelming, it's a lot for me, I almost don't want to believe my teen is having problems, let professionals have some of those conversations and make some of those hard decisions and talk to you about really what exists. And then the family can decide what's best for them, how we move together, collaborating on goals. And I think that's something that is really important to recognize, is that there are free assessments that are available and exist via telephone that you can get just to initially say, okay, maybe there is something going on. And so I think with all of that, I know we went over a ton today in 50 minutes or so, and there's so much more we could talk about, but hopefully that just gives a basic foundation and understanding that, okay, here's what's going on, and here are some ways that maybe I can just become more aware of how to help.
Wonderful. Thank you, Jason and Rosecrance, for sponsoring this event tonight. I know you could probably go on for hours about this topic, but you really did, I feel, give a really meaningful presentation that I think could really hit home with what's going on right now, especially over the past year. So thank you. Very informative. I appreciate it.
Yeah, thank you very much for having me. I mean, This is a topic, like you said, that we could talk about for so long.
Absolutely.
And so just to give some basic understanding to those out there of what's really happening with our adolescents is important.
Yeah, just a few questions. Actually, I do want to say, before I forget, that this Saturday, April 24th, the Elmhurst Police Department is partnering with the Drug Enforcement Administration for a Prescription Drug Take-Back Day. So this Saturday, April 24th, officers will be on hand in the parking lot of the police station to collect expired, unused, or unwanted prescription drugs for safe destruction, 9 a.m. until 2 p.m. Unused, actually, it even says on the City of Elmhurst website, the majority of teenagers abusing prescription drugs get them from the home medicine cabinet of family and friends. No questions asked, bring them, get rid of them. I think that was actually ended up being great timing for tonight. You had mentioned, I just wanted to, you mentioned kids not knowing where the Xanax or benzos come from. Are they, so they're arriving, you're seeing in the past couple of weeks, are they getting them from friends? Is it a known dealer? I mean, I know what you're saying, like you don't necessarily know if it came from a bottle or not, but where is it coming from in terms of my friends are giving it to me, or my dealer who normally gives me this is giving me this now? I mean,
that's a huge, thank you for asking that question, because I think that's something that I definitely could have mentioned that. So what's happened over the pandemic potentially too, or what we're hearing from individuals, I spoke about availability, right? What's readily available to us? What are we seeing? It is possible that individuals just anecdotally are going to people that they haven't been to before, right? So they're getting new dealers. They're getting, as a lot of the individuals would say with me, plugs that they're being able to go get, and they're not sure what they're obtaining from them, especially as they're using. And a lot of times when I'm hearing from individuals, they're saying, "Oh, I took Xanax." Yeah. And then it's like, okay, how do you know? Right. How do you know?
That's really Xanax, right.
So it can be from friends. It can be from new individuals. It can be from somebody who just, maybe they have been providing you with someone's prescription, but that's no longer readily available. And now it's something that is pressed with, we talked about, some opioid or synthetic opioid. It's pressed with something else. And that one-time use could be potentially lethal.
Can you expand a little bit on how benzos, how quick that addiction is? Like how once you start can you expand a little bit about that?
Yeah, I don't want to go into
You don't want to go into too much, but I think the thing is, once you get a bottle, you get another bottle, as opposed to marijuana or something else, how that can be a little bit more, like heroin.
Right.
That could be, which is an opiate, of course, but that could be more catchy. You can tell this is my passion. Right? I know.
It's fantastic, and that's why I think this conversation is great.
I just want parents to realize, though, how quick you can go from, I'm just having fun, or I just got it from a friend, how their body, even if they didn't really want to go that route, gets addicted to that.
Yes, and I think that the best way to talk about it is to talk about it from what I'm hearing directly. So
Sure.
it is absolutely something that is highly addictive, and it does look different in that, well, I'm just going to take one or something, and now my use is progressing, and now I'm taking more pills, especially when it has a potential calming effect, right? And that's really what I'm using it for. Now I become dependent on using it in other areas of life. And even when I'm talking or screening individuals or talking to them, when they talk about that benzo use and then relate it to their marijuana or cannabis use, it's really something that they talk about, and they say, oh, I have to stop that. I have to stop the hard stuff. I don't know how it became out of control like that. I'm not sure about stopping marijuana use, but that I know my body can't handle, I can't do. And we see it even through detox, benzo detox, because we're able to do that for adolescents at our facility. And those days off of it, where the body, you're sleeping and you're ill and sick, that just tells you the reaction to that use.
How quick that is to get there. Yeah. Okay, thank you. You also said you're seeing more coexisting disorders, and you mentioned depressive disorders. Anything else you're seeing? I know that cutting, eating disorders in kids seem to be on the rise over this past year, or more. I know it's been there a lot, but are you seeing that? Are you seeing them kind of run into each other? Or are you? What are you seeing in terms of some other disorders coexisting with alcohol and drugs?
We're definitely seeing, I think you mentioned self-harm.
Yes.
I think that's something we're seeing a lot of. I liken it to any unhealthy way to cope or to feel or not feel. So that self-harm has similar tendencies to that maybe use. And if we don't have that, I'm also using self-harm to manage some of the feelings I'm forced to feel in these moments, or the stressors or the distress that I haven't had before. We are seeing, I mean, even with the use, we talked about eating patterns being different. So is it something that someone's suppressing the eating? Is it the substance? Is it that I'm just not hungry? We're also seeing suicidality, or those thoughts increasing, not necessarily, someone just feeling, that feeling of hopelessness, I think, is something that's important. And then anxiety. Yeah. Anxiety is something that with these substance use disorders, that general sense of worry, that nervousness, even when we're talking about substances, that relation to masking or managing your inhibitions in a social situation, because with adolescents, social skills and pro-social skills are something that is so important. So now that if I have this anxiety or substance use, maybe when I'm using substances, I can actually go out and talk to individuals. I can engage in a different way. I can jump online and be able to communicate differently. So I think those we're seeing go hand in hand as well. Okay, thank you. Hold on, I have a question that came in. She says she has an 8th grader who she has wondered if he has began using marijuana. She doesn't have any proof, but there's been a change in friends and he is moody. She's asked him, he gets really angry and says no, but how can she be on top of this and actually find out? Okay. So, get to that bottom line. Right. So getting to that bottom line, and it sounds like this individual has already asked the direct questions. Right. Has been direct, it sounds like. And he got mad and said no. Right. And so I think a lot of those things that you described, that change in moods, the change in peer group, as some of those warning signs, are also something that can happen in 8th grade. But continuing to keep those lines of communication open, I also am always an advocate, if we're seeing a lot of those things, not having to have the conversation alone. It could be something where you start to get someone else involved in an assessment. Maybe it's not for, you don't even say it's for, marijuana use or something like that. It's just, hey, I notice there's a lot going on. And I think knowing that you're supportive too, I said during the presentation, just saying like, hey, I really care, and these are the things I noticed. I want to be here for you, so when you're ready to talk about it, let me know. So instead of looking for the final, did he use, or is he using, more focusing on what you've noticed, the behaviors that you're seeing. Correct. And such. The exploration of those specific behaviors, and then maybe, there's other explanation for it. There's something that they are willing to then talk about, maybe not, but then maybe if it continues to progress, that's somewhere where someone else can ask those questions and it's not a family member where they're like, no, I need to hide this.
Yeah. Kids have so much more free time over this past year, reduced school hours, cancellation of activities. There's a worry that kids will find trouble as they have less to do with more hours with their friends. Can you speak about this a little and how to kind of navigate through this time?
That's really difficult to navigate because you're right, a lot of the healthy outlets over the last year were potentially disrupted. I think about gym memberships or social gatherings. You said school. I have so many people talk about how they were looking forward to playing a sport and they're not able to practice or do that anymore, or how even something, like I'm going to go hang out with my friend right now or we're going to go take a walk, that wasn't happening as much out of fear of COVID-19 or what we had to do to navigate the pandemic for the first time. So with that, I would always encourage, I actually tell all of the families that I work with to have some level of family interaction, family date nights. You don't have to call it that, but always planning some social time with the family that is a positive thing, that even if it's board games or something, and even if they don't want to, put it on the calendar. A lot of teenagers, even if they think it's silly or stupid sometimes, they do engage in those things. I think there is a way to be on top of it. I talk to a lot of people about dinners, how dinner is being managed over this time. Are we sitting together more now and having some of those social interactions and conversations today, whereas before we were a little more disjointed all over the place, going to and from appointments, things like that. And then, specifically related to substance or some of these services that are available, that could be really positive. If you're involved in the recovery community, there are so many options now for virtual meetings, marathon meetings that you could go, Google and they will pop up for you right then and there at any moment. So if someone needs that support in recovery in a positive way, those are also available to you.
Yeah, that's been one of the benefits. They don't have to get in the car and go to the meeting.
Right.
It's right there at their fingertips.
Any minute of the day, they've been going on and ongoing.
You also had mentioned that there's an ease of getting to the alcohol in the home. The kids are at home more, parents are home more. Maybe they've even increased their drinking and such. Are you seeing kids begin at an earlier age than normal at all?
I don't know if I can say specifically that I've seen that necessarily just in my time, and I don't know if I've...
You have that cutoff of like 8th grade in general.
Right.
Is where you're at. Okay.
Yeah. So I do know just in talking to them with that ease of use and the ability for first-time use, it's just there.
Yeah.
So, and I think it has been more apathetic or available, or family does it, or family had a couple people over and there was something left out or left over. So I think I don't know if I could speak specifically to the ages I'm seeing in that. I don't want to say for sure, but we do notice that we are seeing individuals, even in our treatment, 12, 13 years old, who are getting access to a lot of these things that was like, how has it progressed to this level?
Well, and I'm wondering, is it they're seeing it more at home, maybe even the marijuana too? I know you said, I know, and we've done these presentations before for the Commission on Youth over the years, and one of the things that we've heard is some parents, even going into the marijuana, have said, I'd rather have them smoke weed than drink. And that's, I know one of your answers you said earlier was, well, you're not 21, are you? So you're not, it's not legal, you're not 21. But can you speak about so when you hear that about some parents being okay with it, and some parents are okay with the drinking too, but with the smoking, because they're like, I do it, it's fine, that's fine, I'd rather have them do that. But when it comes into the brain development part, can you speak a little bit about that?
Yeah, so again, what we're seeing is that use in home, and even kind of those general attitudes about recreational use, in that it's okay because it becomes legal or it's medicinal, not even touching the idea of what we know would happen about the increased, potential to use, just saying that, okay, it's, they are using. We do know with that one, that specifically, the earlier that you are exposed and using and more, you are much more likely to have an addiction or use disorder with cannabis or something as you progress. And that's even related to some studies who have looked at that in comparison to young adults and 18 to 25 population, when your brain is still developing but more. If you're using something, 13, 14, 15 years old, that impacts you, the likelihood increases that you're going to have an addiction at some point to that. And then that potential exists too if you're using it for so many different reasons that we talked about, to masks or boredom or escapism. And I know a lot of the individuals I speak to, well, it hasn't been gateway for me. Mm-hmm. But you're using other things.
Right.
So we're still at this point.
Mm-hmm.
So although you started here, there was a reason that you progressed use to other things. So I think that idea that it is just okay has a huge impact on the ever-developing brain of an adolescent, because we have seen there's disruption in learning potentially. Mm-hmm. There's disruption in memory. And I even hear it from individuals. They'll come in and be like, my memory, I don't remember things. Or now I can't sleep without smoking before bed. And now their whole day is disrupted. I'm not eating anything. So if you're thinking about all of these things in relation to development, our overall wellness is being impacted.
Good point. Well, thank you. Is there anything else you think that you'd like to add? I don't have anything else here. Is there anything else? You did a great job. I think it was really great tonight. Seriously, thank you so much. Such an honor to have you here in Rosecrance sponsoring this event. So really appreciate it.
Great. Thank you very much again for having me. I've appreciated being here.
Thank you. I do want to add that there is 24/7 the ability to drop off prescription meds at the police station. There's a drop box. You'd have to get up, go ahead and drop it off. No questions asked. It was just this week. They will be in the parking lot and during those hours on Saturday. And more information is at elmhurst.org. This concludes our issues in youth during COVID. We brought to you depression, anxiety, social issues, social media issues, and bullying and stuff as well. And this was our last one. Hopefully, everyone that has tuned in has learned something. I know I have, and I appreciate everyone we've had, and I definitely appreciate Joe and Dan for being here and recording all these every month that we've done this. Wish everyone well, and thank you for being with us. Have a good night.